Dear attendees, a very warm welcome to this session. My name is Nigel and I will be the MC for this session. This session is titled Busting the Myths of the Community Care Sector. Some housekeeping announcements before we start. In your event screen, there is a Q&A function where you can type your questions for the speakers. Do note that in the interest of time, we shall focus on the top voted questions. Should your questions be unanswered, you may head on to the Q&A feed to ask them, or you may also drop us an email at talent@mohh.com.sg. In case you missed it, we are currently holding a leaderboard contest, and you can also check out the game section to participate in our quizzes and games. A polite reminder not to spam questions or to ask duplicate questions for the benefit of all event participants. As for today's session, we will be starting off with an overview of the community care sector in Singapore and the growing importance of the sector. This overview will be shared by Mr. Derek Tan, Chief of the Manpower and Talent Division at the Agency for Integrated Care. Before Derek starts his sharing, let us watch a video.
Care. What makes it so special?
How is it, Mr. Peter?
Is it the way it makes us feel? How it makes us smile? No. The special thing about care is that it doesn't care. It doesn't care who you are, where you're from.
Is everything okay?
It doesn't care if you're family or a complete stranger. It doesn't care how difficult things get.
No worries, sir.
It always pulls through.
Slowly. Okay, slowly, yeah. Inhale. Good job. Okay.
You see, care is not something only found in the best of us.
Take it slowly, okay? Well done.
It lives in all of us.
Yep. Hi, good afternoon, everyone. Good afternoon to everyone. I'm Derek, and I'm from the Agency for Integrated Care, ANC in short, and I oversee manpower and talent development for the Comcast sector. I hope you enjoyed the video, and it's a good reminder that actually care is in every one of us. And I thought that video in a way is a good lead up to my presentation. And the purpose of my sharing today is really to bring across some thoughts for consideration and to encourage all of you to think about a career in the Comcast sector. But before I go further, congratulations to all those who received your A-level results. And I just want to highlight that the Comcast sector, and should you join us in the sector, you will be playing an important role in helping your family, your loved one, and fellow Singaporeans to live and age well in the community. First and foremost, let me share briefly on what community care is about. Firstly, Comcast sector is part of the Singapore healthcare ecosystem. It covers a wide range of services for seniors who need care and treatment after they are being discharged from the hospitals, as well as those who need healthcare assistance in their daily life. Comcare services and support can be provided in somebody's house, in center-based facilities like senior daycare centers, and in residential settings like the nursing home. So why is Comcare sector important to Singaporeans? As you may know, we face many challenges in the healthcare system. Our population is aging quite rapidly, and by 2030, you'll see that 1 in 4 of us will be aged 65 and above. At the same time, our workforce is shrinking. We are having fewer working adults in proportion to the whole population. And with the affluence and urban lifestyle, we will see increased burden of chronic disease on our healthcare system. At the same time, with increasing prevalence of chronic conditions among Singapore as a result of our lifestyle and diet, we need to continue to drive value in terms of what we can provide and be able to maintain healthcare costs at an affordable price point. In addition, do you know that one in 10 of our seniors are projected to have dementia, have greater frailty, greater physical and mental health need, and it requires all of us to make sure that these needs are taken care of. And what this means is that with aging population, our needs continue to grow in terms of caring for our loved one, as well as for aging family members and population. So what role does AIC play in the Comcast sector? AIC is responsible for the development of the Comcast sector that enables and cares for seniors and Singaporeans out in the community and at home. We work closely with the Ministry of Health, who had announced the 3 Beyonds that are critical to take the Singapore healthcare system forward. Beyond healthcare to health, by supporting Singaporeans to stay active, stay healthy, and be able to maintain a healthy lifestyle going forward. Beyond hospital to community, by providing support care beyond the acute hospital to the community. And beyond quality to value, by enabling Singaporeans to receive healthcare services and support that they need at a sustainable cost. In particular, with the strategic shift in focus beyond acute care in hospital to community care, there is a greater emphasis for appropriate care in the right setting to allow Singaporeans to access healthcare more easily, with greater accessibility and at an affordable cost. As such, in ComCare, we are really talking about the care, the support, and the services that can be provided to fellow Singaporeans, your family members and loved ones within a familiar surrounding. And this is through the services, program, and support network that AIC has or are putting in place with the support of 200 over community care partners or ComCare organization. And these ComCare organizations spans and the services that they provide span across a variety of care settings, whether is it within our day care services, our day hospice, our senior care centers, our senior activity centers, or out at the home through the home therapy, home nursing, home medical services. And should residents or should clients and seniors requires more constant care, they can do so in residential facilities like the nursing home and community hospitals. As we age, we want to continue to stay at home, be with our family, do what we have been doing for the past 20 years. If you interact with your grandparents or with any seniors around you, most of them would share what they would really want to do, and that is to continue living in the comfort of their homes or in the community, being with the loved ones and continue doing what they love most. Hence, the underlying purpose of the ComCare sector goes beyond healthcare. It's about supporting and empowering seniors to manage their health so that they can participate and age actively and meaningfully do what they would want to do in the silver years. So why would you want to consider joining us in the ComCare sector? We are looking out to attract more young, talented individuals into the sector to help lead, shape, and grow the future of ComCare sector with AIC and our partners. Indeed, by joining ComCare, you will be part of a fast-growing sector and make a direct impact to the lives of seniors and clients that you serve. Based on what we have heard from our Comcast scholars, there are 4 reasons that are critical to them in assessing if this is the right path for them. Firstly, do you have an innate desire to want to help others? Do you have the desire to care for others? 2, are you excited to be part of an evergreen and fast-growing sector? Thirdly, are you looking to grow in a sector that has diverse career opportunity where you can contribute and specialize in? And lastly, do you aspire to embark on a career that allows you to make a real difference and impact to another person's life? So these are 4 important factors that you need to consider. And these are 4 factors that we want our young talents to help us build a society that we can be proud of. So this is my last slide. And if you really have the interest to join us in the Comcast sector, I would strongly encourage all of you to consider the scholarship and sponsorship opportunities. Do reach out to us so that we can talk to you further as well and help you decide if this will be a right future for you. And with that, thank you, and I'll hand the session back to Nigel.
Thank you very much, Derek, for your time amidst your busy schedule. We appreciate you sharing with us. We invite you to take your leave now. I would now like to invite the speakers for the next part of the session to join me for a quick introduction. We have Ms. Abigail Yeo, Assistant Director, Manpower and Talent Division at AIC, Ms. Angeline Tan, Senior Staff Nurse at NTUC Health, Ms. Janet Phua, Senior Occupational Therapist at SPD, and Ms. Au Hui Zhen, Deputy Head at Singapore Cancer Society.
Hi. So Nigel, shall I start now? Okay. Hi, everyone. Yeah, thanks for joining us for today's event. So I am Abigail and I am from AIC, Manpower and Talent Division. So together with Derek, whom you have heard his sharing just now, we partner MOH and our community care organizations very closely to drive manpower initiatives for the sector. So I just wanted to share a bit about myself. I have been in both public and private sectors. So I previously worked in organizations such as Public Service Division, National Council of Social Services, as well as MOH Holdings. Yeah, so currently I'm at AIC and I specialize in learning, leadership, talent development, and I have also done some HR and business partnering, talent acquisition, performance management, as well as policy formulation. So a little bit more about myself. I am a strong advocate for healthy living. I believe that prevention is better than cure, and I enjoy Pilates, exercising, and venturing outdoors. So that's a bit about myself, and I would pass on to the next speaker to introduce themselves.
Hi, good afternoon, everyone. My name is Angeline. Next. So some information about myself. I'm 33 years old. I'm currently a senior staff nurse at NTUC Chai Chee Nursing Home. My hobbies and interests includes volunteering at nursing homes previously when I was actually in school. I love to travel. That's a picture of me at Iceland previously. Rollerblading, swimming, and also my pet dog in the photo over there. So about my career as a nurse, I actually graduated from Diploma of Nursing from NYP in 2008. Thereafter, I joined Changi Hospital, mainly because I had most of my attachment there, and I was there for 3 years, learned a lot of things, and decided to focus on my bachelor in nursing, so my degree. Once I graduated from that, I joined NUH under neurosurgery. I was there for about 4 years before I decided to step into community care, where I am currently. So that will be at NTUC Residential Care, which is a nursing home, as a senior staff nurse. And I just finished my advanced diploma in gerontology last year, which is where I am right now. So how I became a nurse, it was mainly because of family influence. I had 2 other nurses in my family. It seemed like quite a good career prospect for me back then. And why I entered community care from acute hospital was when I was working under neurosurgery as a clinic coordinator. I had a vast range of ages of my patients. They range from toddlers, children, adults to elderly. And I always felt very drawn to the elderly somehow because I felt that they always had so many stories to tell, so much experiences to share that usually goes unheard. So, and also the issue of aging population seemed to be more in the spotlight in the recent years. And this actually piqued my interest to step into community care, which I have. Thank you.
Hello everyone, I'm Janet, Senior Occupational Therapist from SPD. I'm happy to be here and very honored to be part of this event. So I graduated from Nanyang Polytechnic in 2010 and started working as OT. In 2013, I received Intermediate and Long-Term Care Upgrading Scholarship to pursue my degree and graduated from SIT. So I started my career in acute hospital and joined community care SPD in 2011. Currently, I'm a senior OT under Therapy Hub Services. And in the past 10 years, I get to work in different community settings. For example, day rehab center, dementia daycare, and residential care. So some info about myself. I'm a mother of 2. And I enjoy reading and movies. And also I'm a coffee lover. I enjoy coffee every morning to start my day. So this is a little bit background about myself. I'll pass to Hui Zhen.
Hello everyone, I'm very happy to see many future healthcare leaders here today. So my name is Hui Zhen. So I came from a very humble family. So I'm a physiotherapist by training. So currently leading a team of very lovely allied health professionals ranging from physiotherapists to occupational therapists, speech therapists, and dietitians, and so on and so forth. So a decade ago, I took on the Balaji Study Award under AIC during my final year of physio schools in Nanyang Polytechnic. And upon graduations, I was very fortunate to be able to work in one of the community hospitals. And a year later, I gotten the similar award from AIC. That's where I then get to study my degree under the Singapore Institute of Technology in partnership with Trinity of College, Dublin, located in Ireland. So my past 5 to 6 years of career, when I first started, I mainly worked with the elderly population group, commonly as the geriatric population group. Usually they will have issues like stroke, dementia, orthopedic cases, and so on and so forth. So, and then in 2017, I did a switch of gear. That's where I specializes working with cancer patients in the community. And it was at the instant point where also I was quite privileged that I got another award from AIC, that I get to travel to Canada to acquire my advanced certifications in lymphedema care for the population group in Singapore. So the past few years has been certainly quite enriching and rewarding. And it's just 2 or 3 years back, under the guidance from my mentor and organization, I get to then venture into the leadership track, where I get to work with different allied health professionals and spearheading several research in Singapore to create evidence-based oncology rehab program for the cancer community in Singapore. So a little bit about myself. So our working hours, if I can go to the next slides. Yeah, thank you. So I love to get connected with the sunshine, because I always believe that if you're active and if you can be able to adopt a healthy lifestyle and healthy mindset, I could then set a good example for my patients to continue to maintain a healthy lifestyle to prevent chronic diseases later on. So I love coffee. Like Jeanette, I love coffee. So I love to have coffee sessions with friends and family to share about different thoughts and perspectives about some of the challenges in life. And this sort of conversations naturally then gave me some inspiration and insight on how to manage or navigate some of the challenges I may face at work or outside the working environment. So you can see before COVID, I used to be able to travel. So I'm quite privileged that during one of the fundraising campaign under my current organization, I get to travel with a very good team of cancer advocates to Mongolia under a very harsh cold conditions. We trekked through the taiga region, and that's where we had created very meaningful bonding, and at the same time fundraise for the cancer community in Singapore. So as you can see, being a physical therapist does not mean that we cannot be active or fun. Regardless of what sort of patients we work with, we can still lead a very healthy and very active lifestyle. Thank you.
Thank you, speakers, for your sharing. And I think we can see from the speakers sharing, right, that the speakers are all very personal people. They're all very personal stories. And like Derek and the video we saw just now, right, Comcare is really all around us. You know, I have elderly parents myself, and I can fully understand the concerns that many people face these days and the importance of community care. Yep, so we have now come to the main part of busting the myths of the Comcare sector. You know, some history on how this came about, all right, was that in the past year or so, the scholarship team actually realized that there were many repeat questions and duplicate questions about certain myths in the sector. You know, many of these are untrue, mainly because, you know, the Comcare sector is still a relatively new one. And in this session, right, we aim to discuss some of those questions with the panel. So can I invite the speakers to turn on their cameras and audio? So for our very first question, right, the question is a simple one. So one common thing we can see is the passion for the sector, right? But the question is, why did you decide to join community care? You know, what's in community care for you?
Okay, so maybe I would start first. Now, I do have a genuine interest in bettering our healthcare system because as my parents age, I do bring them to hospital visits. And it is true that with aging, the conditions then become more chronic and it's more long-term. And so even as I take on caregiving duties with my parents, I do feel that one day I'll also grow old and I'll need the services at some point. So I am, just genuinely interested in making the system better.
Would anyone like to go next?
For me, as I said, I was quite affiliated. I felt a lot of affinity with the elderly when I was working in an acute hospital. Stepping into Comcare actually allowed me to experience a lot with all the elderly, especially in my current workplace at a nursing home. Why I stayed in Comcare is mainly also a lot of autonomy in nursing, which is vastly different from the hospitals in acute setting. In acute settings, there were always doctors around 24/7, whereas maybe in the nursing home, we only have maybe a couple of times a week, or they're not around at midnight. So as nurses, with the elderly that we're looking after every day, we know them very well. We know their basic behavior, we know their usual traits. So we are able to assess them on our own, and we'll be able to do the needed care for them without always having to ask someone to actually back us up on the things that we need to do as well. Yeah, so autonomy in nursing actually did a lot for me to stay in Comcare and really made me appreciate it a lot more.
Thank you, Angeline. How about Janet and Peyton?
Yeah, I think there are two reasons. First will be I get to spend more time with my client in the care delivery as my interest in dementia. So this is especially important in dementia care because I need to spend time with them, understand them, and build rapport with them. Though the other one will be I want to make an impact in client life because it's important to provide timely therapy for our client after discharge from hospital. So you will always hear from elderly, they will tell you, I want to be able to go back to coffee shop, to socialize with my friends, to be able to perform grocery shopping at their nearby provision shop. So all these are small things, but actually it's very meaningful to them. So that will be the two main reasons that I want to stay in the community care.
So for myself, when I was finishing my A-level, I wasn't very sure what the difference between acute and community care. It's only during my physio school, I get the privilege to have clinical attachments at various settings, from acute all the way to community care. That's where I find that community care allows me to be much more closer to my patients, where I get to spend more time with them for their rehabilitation. So as a physio, we do need a certain period of time in order to see a patient through and then ultimately back to their home. So that requires usually a certain period of time that may be more appropriate for me to see them in the community sectors. So I still remember one very special occasion where I first saw my first home therapy patients. That took me around 9 months to rehab. She has a background of stroke with right-sided weakness. Even though the journey is quite long, but I'm quite privileged that I get to journey with her from the point of her admissions to a community hospital all the way back to her home. So eventually she recovered. And then that was very memorable because that was the first time that she uses her right hand, that's affected side, to whip out a very flavorful sambal prawn for me. So that was something that I find it very memorable up to this point of time, even though a decade has passed. So then I felt that, hey, home care may be something that if you're the one that would love to spend more time with patients, seeing the improvement throughout, then it would be a great place for you to be within.
Thank you to our speakers for sharing why community care. You know, I have a friend who worked at the nursing home as well, and I mean, all this is really about the relational, the job satisfaction aspect, and really what it means in community care is that it's really very warm and it's a close-knitted thing. So back to the story, right? So my friend during Chinese New Year, right? So he's actually not Chinese. So Chinese New Year, usually if you're not Chinese, you don't really usually receive ang pao. But there was this uncle at the nursing home, I think a caregiver of a patient there. I think they went around and gave him an ang pao. So he was really, really very touched because I think it was probably his first ang pao ever in that kind of setting. And I mean, the sambal food and so on, all these sort of things are aspects of Comcare that our speakers regularly see. I think it is really slowing down in life, and you tend to really appreciate these sort of things better. So I mean, for a lot of our students and participants, right, I think over the last 2 days, you have seen the acute care setting, you have seen the Comcare setting. There are a lot of differences, but I guess one of the differences is really in the acute care setting, right, it's very fast paced. The focus tends to be on the system trying to discharge the patient because of bed space, because of whatnot. But in Comcare, they really do spend a longer time with the patients and caregivers as well. So it's an entire ecosystem of sorts. Yeah, so let's go to the questions proper. So we extracted these questions out. It was the popular questions for last year's fair, and also a lot of our info sessions, right? The first question is that you only care for seniors in the community care sector. Yep, so any of the speakers can attempt this question.
For me, I don't think it's just the seniors. The NO case, which is a mix of kin and the family of the seniors, right, actually play a very, very big part in the clientele as well. We have to build a very good relationship with them because in the nursing home, the residents actually stay for a very long period of time. And it's very important to keep updating the family members. They're actually a very key part of who we interact with as well. So it's not just the elderly from my point of view.
Thank you, Angeline.
Same as Angeline, because I work in big rehab center. So we have many, we work with different clients with different age group. For example, we have young adult with stroke condition or traumatic brain injury condition. Yeah, so not only with the seniors.
Yeah, so maybe I will chime in from an AIC perspective, because personally my work at AIC focuses on manpower initiatives. So that does impact the Comcare workers, and also if you look at it, yes, it does cut across all age segments, and it also depends on the kind of services that the Comcare organizations is are delivering, and then that goes back into our manpower initiatives. So I would definitely agree with Janet and Angeline that Comcare do not just look at seniors. Yeah, we do look closely at caregiving and the next of kin, yeah, in our area of work.
Thank you, speakers, for sharing. When we tried to understand this question, right, I guess it is also from the perspective of the students. When I was a student back then, right, a lot of the places that we would commonly visit is places like the nursing home, be it my grandparents, or be it CIP, or be it volunteering. So these are the more common Comcare facilities or settings that we are exposed to. But if you notice, right, in Abigail's sharing and even in Derek's sharing, or the sharing that we have done over the past few days, right, the Comcare sector is made up of various settings. So you have daycare services, you have home care. It is really a very vast setting. And I do encourage students, to go and find out more about all the settings as well. Yeah. Okay, another question. So we are at question 2. There is no career progression or development for nurses and AHPs in Comcare. Okay, so this one is a very direct question. Maybe I can trouble the speakers to answer this question.
Not true. So actually, because we have different career pathway and progression for therapists. For example, in SPD, if we choose to develop in clinical area, then we can go to the track that to become senior or principal therapist. But if we choose to go to management track, then we can choose to be like cluster head or manager. So there's different opportunity.
I think for me, actually there's quite a bit of opportunities that's given, whether it be short-term courses or long-term courses. Like short-term can be a couple of days, long-term can be like, for example, my advanced diploma that I completed last year, it was like almost 8 to 9 months. So I was sponsored for such studies and was also recently offered to consider doing a clinical instructor course. So for nursing wise, there's the nurse manager, the nurse clinicians, the nurse educators, and these are still options for us in the community care as well. So I wouldn't say there's no opportunities for progression. Yeah.
Yeah, so again, from AIC, yeah. So community care is really a complex space, right? It's not just looking at taking care of the elders physically or helping the caregivers physically. It is a complex space. And if you think about it, how do you provide holistic care? It actually involves a lot of skills. You need to work with a multidisciplinary team, like, right, comprising of nurses, your allied health professions, and sometimes even doctors, and looking at kind of counseling with caregivers as well. So right now, we also look at the social aspects of aging, right? So social issues faced by the elderly and their caregivers, the psychosocial aspect, the mental well-being. So it is actually a sector that requires skilled workforce, and it does offer good career and progression. Yeah.
Thank you, Abigail.
If I may add on, sorry for that. I think myself is a very good example when I started off as a junior physiotherapist, and then went on to become a more skilled clinician and eventually taking on the leadership track. So eventually, I think at the organization level, there's already a structured policy in place in terms of advancement, whether you're looking at the clinical track, the research track, or the management track. I think these are quite solid within each organization. But I guess what's beauty about community care is now that we have partners like AIC into it, it makes training and funding a much more multi-directional, so that in case organization has some issues to sort of provide trainings or courses, that AIC will step in to provide funding in order to enhance the manpower skill set and so on and so forth. So I think with these two here in mind, within the institutions and the support from the external partners certainly has made the career progressions in the community care much more enriching as compared to maybe 20 years back. So I think we're pretty on par with the acute side, if I were to take myself as an example. Yeah.
Thank you, speakers, for sharing. I do think there are many misconceptions amongst our students that, when you are in Comcare, right, either you're a volunteer or you're just a worker, therapist. But it's actually not true, because in the Comcare setting, as we can see from the speakers, right, they are actual AHPs and nurses. So if they're actual nurses and AHPs, right, they would have something we discussed in the past few days, which is the nursing and AHP career tracks. So the same sort of tracks will apply to them, your education tracks, your research tracks, your clinical tracks. And I think from the speakers here, we can see that their career progression has been reflecting that. Yep, so the next question is tied to career progression. The next question says that the pay is low in the community care sector.
Anyone want to start first? If not, I would share that what I personally I don't think that the pay is low. We do offer competitive salaries for the sector. So what AIC does at our end is that we have yearly salary benchmarking exercises. So we do go out, collect salary data, look at adjacent markets, and we peg our salary against the market to see if our salaries are competitive. So what we do also is that we do inform our Comcare organizations on such reports so that we can nudge them to compare their salary structures with the market and how to guide them towards a competitive towards offering competitive salary. So I would like to debunk that myth, and I welcome our panelists to join me in debunking that myth as well.
I do agree with Abigail that it's quite competitive, so we're quite happy.
I often get asked these questions when I was doing recruitment for my organization. And I think salary, it's no doubt it's important, but I think it's sometimes arbitrary values. So I think in terms of on par, I think in a sense, we're definitely on par with the acute side. I think what's more additional that we can offer is, of course, the additional funding from the external organizations, like for example, AIC in short. They allow us to have additional funding aside to bring our staff for further training and further development. For example, overseas in Canada for myself, these are such things that acute may have some challenges with, because there are a lot of people within a department. Say, for example, a PT department, they have over 100 of people. That makes, when you only have 10 apples to be distributed among 100 people, then you may get a chance, but maybe at a later stage. Whereas from EIC, I think they've been quite beautiful in the sense that they allocated enough funding for each organization in the community, because we know that it's a long-term partnership, it's a long-term rehab process. That's where they can actually give us additional funding that maybe in the acute side they may not be able to. So I agree with what Abigail has shared in terms of the salary-wise. Arbitrary-wise, we are quite on par, but I think there's additional things that is good for the students to know as well in terms of professional development in long-term run.
Thank you, speakers. Since we are on the topic of students, right, I guess to also share with the students, right, in healthcare or rather in Comcare, right, it's also important that you don't really only look at the salary or pay package. It's also very important to look at your job satisfaction and what you learn from your career, right? Because these days, I mean, I speak for some of my younger friends. I'm not too sure if that is for everybody, but the general trend is that job satisfaction is getting more and more important. Finding meaning in what you do is important these days. It is almost on par with the salary package and so on. So do ask yourself, right, if you are going to the healthcare sector, the Comcare sector, is it really the money that you're going after, or are you looking to make a difference in someone's lives? So it's all very important, because this is your next stage of life. So do consider that carefully. And another thing as well, right, since we are on this, so we do work with Comcare scholars, right? And, from, I work in the training side of things, right, the HR side of things. From that perspective, right, I also tend to see Comcare as something where, as a young graduate, if you have graduated and you go to work in the Comcare setting, right, you're being exposed to a lot of skills immediately, very future-ready, future-proof skills. Things like empathy, things like emotional intelligence, things like dealing with your caregivers, dealing with your patients, home visits, you sort of grow up quickly in that sense, I feel. Because you do need to have these skills, right? When you go on your home visits and your patient isn't really listening to you, or your patient is not there, or your patient tries to run away. I mean, I grew up with those also because I visited my grandparents regularly in the nursing home line. They would run away, and I would see the look on the Comcare professional spaces, right? They were like, whoa, but they were like, they're very calm, so they're very zai. So zai also means like very calm, very, they are aware, know what to do, that sort of thing. So those sort of things, if you can learn them at the very start of your career as a young graduate, right? I think these do add a lot of value to your career and your, as a whole package. And I mean, you have your whole life to earn money lah. So why not come and learn some skills, make yourself, learn some future ready skills. So these are quite important, I feel, for a young graduate these days. Yeah. Okay, we shall move on to the next question. So the next question is that there are little resources in the community care sector and the professionals are stretched thin with little guidance. Yeah, so over to the professionals.
Maybe I can start. So if you ask me, right, I don't see it that way, because maybe in SPD, we have a big pool of therapists where we have very structured supervision model. We have supervisor, principal therapists. They are there to guide us. Also, we have like weekly in-service meeting, monthly meet up with all the therapists, so that all this allow us to have the opportunity for clinical sharing or cross-training among clinicians. So sometimes not only with our own discipline, OT will also work closely with physiotherapists, speech therapists to learn from each other. Yeah.
Yeah, would the rest like to add on as well?
I think the landscape for community has evolved vastly over the past decade. So in fact, when I first came into community care a decade ago, there were already available senior clinicians on board to sort of guide me through step by step on various settings, as mentioned, I think inpatient and community hospital, outpatient and then home therapy, so on and so forth. So I actually believe that a decade later, I'm very confident that at this point of time, there are actually even more than sufficient mentors available in the community care sectors to help to develop each individual, especially the junior therapists, individually on their career development track, which track they want to put in. I think they are more than well equipped to part the clinician's interest based on their own individualized professional development. And that can be through various courses and training that's heavily subsidized.
I think maybe when they say, they are stretched thin as little resources, it could be the impression that because working in community care, you need a certain level of independence. They may see that we are working alone, but actually what they do not see is that we have a lot of, like, as they said, mentors, we have a lot of trainings. We actually do work in teams. And regarding resources, I think from the government, there is pretty much quite a lot of resources, especially currently, where there's a lot of focus on elder care. There's really an urgency for professional elder care in Singapore. So a lot of these resources are coming from the various companies and government bodies as well. Yeah.
Yeah, so maybe I'll just add in on the part about professionals being stretched thin with little guidance. That is definitely not true. What I know from the ground is that the clinical teams are really quite strict, right, on assessing your competencies, making sure that you pass certain competencies before you can be independent to practice. So there is guidance on the ground, as our panelists have shared as well, and they are the best people to share, right, because they are on the ground. And I guess from my perspective is that if you're talking about little resources in terms of manpower, because that's what a lot of people are. I mean, if you read the news, right, a lot of news about healthcare, manpower being stretched these days. So I guess we do acknowledge that COVID has impacted manpower, right, and impacted resources. But I do not think that this is unique to healthcare, right? It cuts across a lot of industries. It is actually a global trend, right? So it's not just healthcare. although you do see more reports on healthcare coming in these days, not just healthcare, not just community care, but I think what is good is that AIC, we are working very closely with our Comcast organizations. We work very closely with MOH to ensure that resources, funding, step-in manpower, and also quite recently, we are calling for volunteers through the Singapore Healthcare Corps to augment manpower, to help out, and really all hands on deck. So we do step in when necessary in terms of resources, manpower to help continue, the work with our Comcast organizations. Yeah.
Yeah, I agree with Abigail as well. So regarding COVID, right, a lot of the students, past 2 days, you have been asking questions on, is it true that manpower is stretched? How do you cope with stress and so on? So it is a global thing, and but the truth is that COVID won't be here forever, although the next pandemic might come, no one really knows. But there will come a time where we actually take a breather, recalibrate, and we study what has been done in the past few months. Where are areas we need to put more efforts in, where do we need to change certain policies, and these will be done for sure. And if we go back to a state of normalcy, right, just now when the speakers shared their introduction slides, you can see that there is life in Comcast. So it is not true that manpower is stretched. You need to be working and you can't take breaks. I see some of the shots of the traveling shots. I think everyone is all ready to travel when COVID clears up. We are like all, for the younger people, it will be even worse because younger people are travel bugs, right? So yeah, I think it is a global thing, and while the manpower is stretched now, it won't be forever. And do rest assured that things are being done from the ministry level, from the AIC level to beef up Comcare. Yeah.
Maybe Nigel, sorry, I just want to add just one last thing is that it's not our country has been through this as well. We had SARS, right, back then, and the healthcare system did pull through as well. But of course, a lot of people work very hard and tirelessly to pull us through. Yeah. So now we are, yes, still in the midst of that pandemic and transiting to endemic. But I am sure that we will be able to pull through with the help of all our healthcare professionals and our Comcare professionals as well.
Yeah, I'm quite grateful to know that Abigail shares the same positivity as me. But yes, we can only look forward to the future. So next question is a question on facilities. So I think this question came about because of facilities. When you go to the nursing homes and so on, it doesn't look as grand as an acute hospital for sure because of the whole setting, right? But is it true that the facilities in Comcare are very basic and that there is no cutting edge equipment and technology available? Yeah, so the speakers may share.
Actually, for me at my nursing home, maybe these people haven't come to my nursing home yet, but actually the equipment we have actually all very good. Even recently we had this computer on wheels. It's not the usual computer on wheels like in the hospital where it's just a laptop for the staff to use, but it's more of a high resolution camera with very good audio. This is to help with the teleconsultations that we have in view of the COVID period, so that the doctors and nurses can actually do teleconsultations from remotely. We even have this like robotic seal. It's called Paro. You guys can Google it. It's actually had a lot of studies done on it, and it actually helps dementia patients respond well. They stimulate interaction, socialization, relaxes their moods as well. So we have all these up and coming equipment, things to actually help the elderly as well. So I don't think that we are, no cutting edge technology will not be right at this point.
Thank you, Angeline.
Just to add on, from a rehab perspective, we are seeing a lot more community care organization having a lot of innovative technology. Like for example, our HER strengthening machines from Finland. It makes rehab much more cleaner, easier for the clinician. And these are, to my knowledge, probably not available in the acute sector, for example, because of whatever reason they have. So that's one. And of course, other innovative things like virtual reality, virtual consultation, all these are quite on par with the restructured hospital. So in fact, recently, because I'm an advocate for swelling management. So recently, I think we're quite blessed that we had quite a large fund given to us to sort of bringing out more advanced technology to manage lymphedema in cancer patients. So in fact, I think that community may have a little bit more innovative technology as compared to acute, where they may have different focus because of whatever reason. So I think it's probably not very appropriate to say that we do not have cutting edge tools in community care. Yeah.
Maybe to add on, in our day rehab center, we have her machine as well, like what Hui Zhen said. Yeah, so it's very wheelchair friendly and elderly friendly. Also, SPD, we have specialized assistive technology center in EV to help to advocate and train on the use of AT devices. So maybe overall, I feel like we need to understand what we want the technology to do for our clients, because we have a mix of both low and high tech devices to suit the client's needs. So most important, we need to know what works best for them. Yeah.
I'll just last that in that AIC does look at driving digitalization, innovation, and productivity projects with the Comcast organizations. So we do also have projects that, for example, look at how do we imagine nursing home to be in the future, so that we can start designing for people who are aging, let's say like 20 years from now, and what are the technology to put in place. And there are Comcast organizations that I visited that I saw automated guided vehicles, I think, yeah, that were delivering laundry or even doing meals serving. So that was I thought that was quite cool, right? Yeah, and there are also deployment of wound assessment technology within Comcast organizations, right, to improve like the quality of wound assessing capabilities. Yeah, so we do have quite good technology going on there. Yeah.
Thank you, speakers, for sharing. Yeah, so to our students, right, the next time you visit a Comcast facility, right, do look out for these technologies. You might see one of them in action. I actually saw one of them in action when I did some filming at one of the new community hospitals last year. So when we were doing the filming at the gym, right, so it's a gym for the elderly, there are PTs, OTs there. I didn't know how to use the equipment, so I was quite curious. Like I wanted to like go and see how to use. It was like, I think, this strength resistance machine, and I was very shocked when the professional actually told me, "Oh, come and control." So he actually went to the computer terminal there to press something and change the hydraulic setting or something like that. And then I realized, oh, the setting of the weight changed. So if you go to a typical gym, right, you know, those very old school one, you need to take out the screw, you put inside, then you adjust 1 weight, 2 weight, 3 weight. So it is not true that the Comcast setting doesn't have cutting edge equipment. I do think many of the equipment is there to assist with the rehab or the safety with the elderly. Probably not so much of how to it's not the same as hospital where their equipment is, trying to find the next cure for cancer, trying to kill a cell, that sort of thing. But it is really meant to aid in the rehab process, in the whole community care setting, and providing the best care to the patients and clients. So I do encourage students to take a closer look the next time you are in such a facility. Okay, next question. So next question is linked to the elderly. So the Comcare is all about palliative care and assisting disabled persons. Yep, so speakers, you may go ahead.
For myself in the nursing home, actually, there's the thought that is mainly elderly, but we do have even a rehab ward that we have patients like maybe about 50s in their middle age that maybe like previously they mentioned road traffic accidents. We do let them go through rehabilitation and do discharge them after. So that'll be the aim for some of the residents in our nursing home as well. So it's not mainly just elderly for my care.
I think same for my side, we work with different clientele group. So like client stroke condition, hip fracture, Parkinson or dementia conditions, so not just about palliative care. Also, I think because working in day rehab center, we have to help them to go through the different rehab recovery journey and work towards active goal to help them return back to their pre-morbid, like back to school, back to work, and back to leisure tasks. So not about the end stage of like the care, but it's about the whole spectrum.
Just to add on a little bit, so even though we are facing aging population group, but it also means that the medical technology has become more advanced, which means people are getting diagnosed at earlier age. So coming from my perspective in terms of rehab, I do see patients as young as 19 all the way up to as old as 90 years old. So I guess the younger population group has different life goals when they're in their prime. So that's where the rehab portion has to kickstart way earlier. So we do not just work with health people towards the end of their life, but rather we work with a much more complex group of population group, especially the younger population group, where they have a lot of active goals to go back to work, sports, or even family commitment. So it's true that we work with different people of different age in community care as well.
Yeah. So I think the focus that or rather community care is to help people in general age in place, right? Or rather integrate back to the community. That's why we are called community care. Yeah. So it is not just palliative care. It's not just assisting disabled people. I mean, of course, we do that as well, but that is not the entire focus. The focus is really how we empower people. Yes, we do serve quite a huge elderly population, but how to help them integrate back to the community, the society, going back to the families, and even rebuilding that social integration. So that is not true about just, all doom and gloomy. And we do have a lot of initiatives that help elderly regain their mobility, their independence, and that is actually a rather happy thing to do. Yeah. So not all gloom and doom. Yeah.
Thank you, speakers, for sharing. Okay, we shall now move on to the next question, which is, the question is, I am only a manpower in the community care sector. Yeah, speakers, would you like to address the question?
Maybe I'll start first. That question, well, to me, it felt like, oh, I'm only a number. You just want me to work and you don't care about me as a person, but that is not true, right? That is not true. We do work very closely with the Comcast organizations, as I mentioned just now, on a lot of developmental opportunities, a lot of funding. So we have, for example, like our scholarships, which is why we're having this fair now, right? We have also Comcast developmental, like manpower developmental awards. We have leadership programs for various disciplines to look at how to groom the individual. So we do want to walk that journey with our Comcast professionals, and it is not true that we just view everyone as a manpower or a number within the sector.
Do other speakers have anything to add on?
Personally, I also don't see myself as a manpower in the community. And actually, I kind of enjoy working in Comcare, also because of my interest in dementia, right? So I think this is the right sector for me to be able to work with them, even like work in a nursing home and dementia daycare where I can really know them and provide the right intervention for them. Yeah, so I don't see myself as a manpower.
And the nature of community care is where we spend more time with our patients, spend more time with allied health professionals. So it's a multi-D team. No doubt we may not be as fast-paced at acute side. I think that the good thing about that is we get to spend more time with patients, with your colleagues, and that's where we create a family. So I think I do not think that we're just only a manpower. In fact, I think we get time to forge very meaningful friendships out of just working colleagues and also with our patient as well. And that is the point that helps to patients indirectly to then integrate back to their previous role. Yeah.
Thank you, speakers. I do think this confusion of perception that people are manpower, even in the healthcare sector, right? It's also caused by our perception of things, right? You know, when we visit the hospital or nursing home, we always look at the, let's say a community nurse or a nurse, we always look at the tasks they do, and we always observe them from a patient point of view or a family point of view where, you know, they do certain things like serving food, cleaning up. So you tend to think that they are manpower, but I mean, from the things that the speakers have said, right, there are so many other things that go into their daily routine, right? They are working in teams, they probably, you know, in their own multidisciplinary teams, they discuss on treatment plans for the patients. They are in meetings, they are educating junior staff, they are coaching junior staff, they are doing all these sort of things. So they are not only manpowers. I think our Comcare professionals are leaders. They are also professionals in their own right. And even today, right, you can see from this session that they are doing this talk with us here, educating students. So they are certainly not manpower. And I think that is something that we should try to change our perception on. Yeah. Okay. Next question. So this is almost at the end already. We are almost at the end of the discussion. So next question is, home nursing and therapy is unsafe and there is a high chance of abuse. So panelists, do you want to share your views on this?
Currently, I'm still providing home therapy services. So I must say we have different SOP in place to ensure safety of client. So the first stage, right, even myself, our center manager, we will screen the case thoroughly. So if we individual with any violent or disruptive behavior that cannot be managed, so maybe we won't admit them to our home care services to ensure the safety of our clients. Yeah, so if we can manage them, but we have other concern, then sometimes we will go together with our therapy assistant, or we will go with our colleague first just to assess the situation and see whether we are safe to provide the services. Yeah.
Thank you, Janet, for sharing.
I have the opportunity to set up home therapy services some time back. So in fact, my encounter was majority pleasant and very enriching. No doubt there's some difficult cases for sure. So I think it actually depends on how, what Gina has mentioned, how we screen the potential risks. And I think firstly, if let's say we think that these patients can have complex family background, that's where we may want to bring along a second person. So that could be a therapy assistant or social worker to ensure that our safety is not being compromised. And secondly, within each organization, we have our own policies in place to make sure that our clinicians are not physically or verbally abused. So this is something that we do not tolerate in the community sector as well.
Personally, for me, because I work in a nursing home, I've been in acute hospitals for about maybe 8 years prior to that, and I faced my fair share of, you know, all such issues. There's different sets of challenges in whether it's in an acute hospital or a nursing home, but I do feel that patients admitted in a hospital, they can possibly be more demanding because maybe they're stressed when maybe they receive some news on some life-changing diseases like cancer or diabetes, when they realize, oh, I have to give my own insulin every day. They really get stressed. Or maybe it's a new environment from home to hospital. So in comparison to my current state in a nursing home, most of the residents have actually are from acute settings. So they're discharged from the hospitals over here and they're pretty much stabilized their health conditions. They've come to terms and are probably on the road to recovery already. So as they're with us long term, actually, we build a very good rapport, or we try to build a very good rapport with the residents. Like for me personally, I go to work every day and there's like 45 like grandmas, grandpas, uncles, and aunties to me. And you know, there's always a group of them who will say, oh, your off day yesterday, they've missed you so much. And so there's really a vast contrast, whereas in the hospitals, they are more emotionally charged in that sense. So that's where the difference would be like for me if we're talking about facing abuse.
So for me, my experience have largely been positive as well. So I do visit I do go to the Comcast organizations like nursing homes and daycare centers to do my rounds as well, right? And visit. So my own sense is that generally elderly folks can be quite stubborn, right? I mean, yeah, they can be quite stubborn. Some especially if, let's say, it's the first time you are going for a home visit and they do not know you, you're a stranger, and you're trying to coax them into doing something that perhaps they don't usually do. Yeah, and they'll tell you, oh, I don't need to eat my medicine, you know, I know best, I know that this doesn't work. And yes, sometimes they do get angry, but generally old folks, they tend to have that sometimes, right? And it's really how you in the end build the relationship with them. And in Comcare, as I think as this discussion has been going, you do see that our role is really crucial in building that long-term relationship and trust with them. And once they start seeing you, they start knowing you as a person, their initial resistance would generally go away, right? I'm sure you talk to your own grandparents and sometimes it's like that, isn't it? Yeah, and generally they open up after a while. Of course, there may be cases who are genuinely abusive, but as I think our panelists here have shared, all the organizations do have strict policies on how to safeguard their staff. So this is strictly observed in our sector. Yeah, so we do not tolerate abuse. But generally, all my experience has been quite positive. Yeah, so even when I go to a nursing home, there was once this elderly grandma just took my hand and held my hand. And we just sat there and didn't talk. And she turned and looked at me and smiled. And it was a very nice 5 minutes. Yeah, even though we were not talking, because I think she was speaking in Hokkien and I couldn't speak Hokkien. Yeah, but it was a nice experience. So yeah, so just wanted to share that. Yeah.
Thank you, Abigail, for sharing. Speaking to the students here, not only from the healthcare perspective, right? All industries, all sectors, you will face abuse in some form or another. So I think it's very important to be open about it, you know, be able to identify it, and you know the mechanisms in place, whichever organizations you're going to do, be aware of them, and you know draw some boundaries. You know, it is the working world lah, so you will face this even if you do not join, you know, the healthcare sector. Yeah, so we have come to almost the end, and the last question is actually a parting question, or rather we close the discussion on this panel, right? What advice do you have for our students who may want to go into the community care sector? Yeah, so speakers, do feel free to chime in.
I would say maybe students to enter with an open heart, with an open mind. It is actually pretty different from what we're exposed to as students. At least personally, during my attachments, it's something very different when I step into community care, but it's superbly rewarding. For me, I don't see these human beings as, you know, a diagnosis, a bed number, a patient with difficult veins, a patient for surgery. I see them as a whole. I see them as a mother, a father, someone who has likes and dislikes of food. You really see them as a human being and you know them very personally. So it's very rewarding for me.
Same as Angeline, because we work with, in community care, we always need to work with different stakeholders, not only the family members, even the social worker, and also other organization, acute side, community hospital side. So I think it's like have an open heart, and teamwork and holistic care, they are very important. So always bear in mind that in community care.
I would think that to better understand the actual work done by the community care clinician, I always encourage all students, even entry level clinicians, to have a day observational attachments with any of the community organization to better understand, to hear from the ground what are the actual differences between acute and community.
I think I'll just add on that join the sector if you do have the passion, right, to help, to make a difference in people's lives. But that said, it is a sunrise industry, and beyond just making a difference, it is also a sector that gives you a lot of opportunity to learn, right, the holistic skills, the knowledge to hone yourself, and to become someone who is very holistic in assessing the needs of, how to age in place, age in community. Yeah, so it is a sector that has very good opportunities. So join us if you have the passion. Yeah.
Thank you, speakers. We have now come to the end of the discussion, and we shall attempt some questions from the students Q&A session. The students Q&A section. So we will be answering some questions. Hold on, let me see first. So we do have some questions around the emotional aspects, around COVID-19, around starting my career in Comcare. Perhaps we will look at perhaps we answer the question in the career in Comcare first. So some of our students, they are asking, right, do I start my career in Comcare or acute care or vice versa? What are the considerations? Because you all want to answer this question?
I think for me, my perspective would be during your nursing days or maybe during your student days, you would have some taste of what are the possibilities out there during attachment. Maybe you see what you prefer, where your heart is bringing you towards, and you can decide from there. Because for acute, it's very fast paced. It's always for discharge. You always want to heal the patient, and then they go home. For Comcare, it's a long-term thing for the residents, for the patients as well. So it's more of their preference-wise.
I think there's no priority of which one to join, but it depends on a very personal level. And in fact, I think the healthcare sector has become so flexible such that even if you're in the community care, if let's say you join the community care for a period of time and you wanted to have something additional skill set, for example, ICU or high dependency skill set, for example, we do still work with acute hospital. That's where we have attachments with the acute hospital. We do sort of certain exchange, occasional exchange. We have patients coming from their side to our center and then our center over to the other area. So I think it depends really on a very personal level, which is your first decision. And then after that, if let's say you still want to have a taste of Comcare or acute, definitely there's avenue to have a taste of it as well. But otherwise, this is a very personal decisions to make depending on what sort of career advancements you want, whether or not you prefer a more work-life balance kind, or you prefer a more fast pace to absorb information like a sponge. So that depends really very at a personal level.
Maybe I'll also add in to say that I agree. It is really up to you. It depends on your personal aspirations. I think the question could so when long time ago when I was still a student and I was graduating, I also asked, should I join the public sector first or the private sector first? It seems like a similar question, right? And there will always be people who justify to you why you should join the public sector first and then the private, or vice versa. But in the end, it really depends on your goals and your aspirations, I think, at that time as well. So just evaluate, think of where your passion lies, where your skill sets lies, and I think you would then evaluate and come to a decision on that. Yeah.
Thank you, speakers, for sharing. Some advertising for our community nursing scholarship lah. So when you are awarded this scholarship, right, you will also go through a 1-year development program after you graduate. So you will spend 6 months in the acute setting for your first posting, right, to gain exposure to the setting. After that, your second posting, you will spend 6 months in the community care institution to gain an understanding of what goes on there. I do think in like what Hui Zhen has mentioned, right, we have come a long way. There are many integrations between acute and Comcare. And I think that is for the setting, right? As a nurse and as an HP, right, you don't need to worry as well, because like I mentioned earlier, for Comcare professionals in the setting, right, they are all qualified AHPs, qualified nurses. You do learn and practice the skills as well. In fact, it's probably more difficult because of the clients and patients that you're dealing with. As Vicky mentioned, they can be stubborn, they can be, that sort of thing. So yes, I do think you can take their answers in consideration as you apply to your uni, or you can actually you can spend some time to think about it because you still need to study. Okay, next question, right, is about the emotional aspect of things. So the question is, how do you deal with emotional aspect when a patient who you have been with for a long time passes away? Yeah, speakers, do you want to share?
I work with palliative patients, largely a lot of cancer population group, and I think it's normal to be grieving. It's okay to feel sad, but I think the most important part is to acknowledge your feeling, because we're all human beings. Even though we are healthcare profession, does not mean that we don't have feelings. So how to deal with it? I think first step is acknowledge the feeling while maintaining professionalism in front of a patient. Sometimes I do not encourage we cry in front of patient, because I think there's certain ethics that we still need to abide to, but that does not mean that you hide your feelings. So generally after your sessions, say for example, today I see my patient, they passed away. Then after we finish the session, that's where we back off, and then we talk to our mentors and our team, because we have a different teammates working together to serve this patient. We are not alone. There's doctors and nurses and also counselor that we can actually sit down together to do a debrief. Debrief may not be a nice word to describe, but that's essentially where we get a chance to discuss about this patient's care, and then what could we have done better, what's the emotional aspect we are experiencing right now. And I think it's normal to accept grieving. While patient's family is grieving, we're also grieving as well. But I guess the additional support that we get is from the team members that also journey with us through the same journey. And that's where how we get to deal with the emotional part. That's the majority of cases. But for certain cases that it may hit you so strongly, organizations do have funding set aside for us to undergo through some counseling sessions with our external partners as well. Put these are things in place to sort of troubleshoot extreme cases that we may have faced later on. Yeah.
Maybe I'll share my personal experience. So after years in the hospital, when I went to a nursing home, the first resident that passed away, it was like when I was in the hospital, it was the same. But when the family members were with the resident, I had nurses who actually stayed, because we have dormitories. So we actually have nurses coming down on their off days or after their shift. They came to the ward and they said, we would like to come and say goodbye. So I was like, oh, this is very different from me. This is something that really opened my eyes to how much these nurses actually bonded with the resident. And of course, we have to ask the patient's family members for permission to, for the nurses also to come in and say goodbye. And when I asked the daughter, like, are you all right if my nurses said goodbye to auntie before, she's being taken away? She actually broke down. She was like, I cannot believe that you guys love her so much in a way. And it really brought a lot of comfort to her that her mother played such an important part to us as healthcare workers as well. So it's a vice versa way. Ever since then, my opinion or my train of thought about death has changed. In the hospital, I always like we try to avoid death. Who the patients die on your watch, you're a bit unlucky or there's a stigma of death. But ever since coming community care, it's very different. You actually feel that you have contributed to a certain extent to the comfort of the patient. You feel, I wouldn't say you feel happy, but you feel proud that you actually made the patient as comfortable as possible. You made sure that they didn't suffer. You contributed to them to the end of life, caring for them. So this actually changed my perspective of dying as a whole for residents. Yeah.
So same thing, because we have very close team working together. So sometimes it's just not just about yourself dealing with the emotional aspect. Everyone, they have the same emotion, so we will always support each other. So to highlight, maybe also if you're working in nursing home, I think it's good to make a good closure with other residents as well. If the resident pass away, then you will see actually the other resident, they have feelings as well. So we will have like a good counseling session together, good closer session with them. Yeah.
Thank you, speakers, for sharing. Dealing with loss is not something that is easy to deal with. It is also something that challenges you mentally, right? And over the past few days, we have seen that a lot of questions center around these sort of challenges, be it someone passing on, be it the current COVID crunch, be it your working life, your stress at work. For our students out there, right, self-care is something that you need to take charge of self-care and your own mental health also. So the past speakers have shared, right, if you are facing issues, you can open up to your supervisor, you can open up to your colleagues. If you feel that today is a long day and you feel that you're burning out, you feel that you need space, talk to them, let them know. And in the midst of all this, right, do ensure also that you have things that you can turn to. You have hobbies, you have situations or opportunities to just chill out, go out with friends. These work for a variety of people. In fact, certain people have different ways of distressing. Some people do sports. I think earlier this afternoon, our speakers, one of them likes sports. Some people do have pets, some people go out. So these sort of things are important in your journey, not only as a healthcare professional, right, but as a working professional, as even if you're not working, these are also important things. So do take note of them. And just want to highlight that if you have issues, it is not something that you should shy away from. So yep, do go and view the previous sessions, go and Google, see how you can cope with in this current situation, pandemic, or even in the future when you face such scenarios. Okay, so next question is one on dementia. So it's one of my favorite questions because of personal reasons. The question is, how do you deal with abusive residents with dementia? The strict policy against abuse doesn't apply to this group who have no cognitive ability. Yeah, to our speakers, over to our speakers.
Maybe I can share. I think I just attended a dementia training past few days. So I think the speaker also kind of like tried to ask us to think about, we don't see them as abusive people, because sometimes when they have behavior issue, because they have many unmet needs, they have feeling, they have pain, they cannot express out. So they have behavior issue. So instead of like see them as a difficult behavior problem, we will see them as like behavior of concern to analyze what's exactly that happen inside them. And also we don't see them like difficult person, but person who really need help. So if you change your perspective to see this group of people, then you might be able to change your mindset. So like how to calm them down and how to work with them. But we have also other policies in place, like if they are really cause danger to your safety, and then what can we do? What is the backup plan? Or we have a sensory room to calm them down. Maybe you can bring them in first to calm them down before you talk to them. Also assign a person that really got close bonding, close rapport with them, that you can work with them to calm them down, and then only you can solve all the behavior issue. Yeah.
I think I agree with Janet. It's really a lot about perspective. It's very important to remember that it's not personal. It's really the disease process, and not to take things too hard. So
maybe I'll add on, but I'm not working on the ground, so maybe the panelists can also add in if I add from your perspective. But I have visited some nursing homes where I have observed like a dementia resident who refused to take medication. So there were 3 staff, care staff, nurses as well, and it was quite, because it was that was my first time witnessing it, and I have to say that the staff were very, very skilled. So they in the end they didn't so-called force the resident to take the medication, but because I was there for a few hours, so subsequently when they went back to try, then the resident did take the medication, and I then spoke to one of the care staff and asked them and asked her how do you deal with such situation, and she kind of just said, oh, this is fine, they have dementia, is their condition, and I've been working here for a while. I understand her. She even though she has dementia, but we have built that bond. I have that understanding with her. I know what works and what do not work. So when she's in this certain mood, I will try this. She's in another mood, I'll try this. So we kind of know what to expect and how to get her to eat her medication. It's not like she just said it as if, oh, it's not a big deal, right? We can handle it because we are skilled. We have that relationship with the resident, and we can do it. So that kind of blew my mind away. So I think I agree with what the panelists said. We do not see them as abusive. You understand that the person has a condition, and even in that situation, you build a relationship with the person, right? If it's not you, then your staff, like the staff who are in the Comcast organization, and after some time, because you are trained, because you have the skills, you know how it works, you actually can work with the person, to eat medication, take a shower, or do exercises and things like that. So yes, do not see them as abusive, but as time goes by, once you have built that knowledge and that experience, you do know how to handle that situation, and it's not like abusive to staff. So that's what I would add.
Thank you, Abigail. So I also share my view, right, as a caregiver. So this is years ago already lah. So dementia questions are one of my favorite because I used to care for my late grandfather. So he has dementia and he was in a nursing home, and he is quite abusive in the sense that he does scold quite a lot. I mean, people from the age, they generally tend to be like that because of their background. But you know, his dementia is on and off. So towards the later stages of his dementia, where he was a bit blur most of the time, I actually noticed this later towards the end lah, because I guess earlier on I was still pretty young. You don't really make sense of what the professionals were doing. But towards the end, right, I noticed that they did two things while trying to address his dementia, right? When he started getting worked up and, you know, did his verbal abuse, they didn't classify him as like doing something illegal or criminal, but instead they responded with very practical things. So one thing that they did was that they just let him continue. So they let him continue, but they very importantly, right, they made sure that they were there. So they were present. And I can tell you, this present thing is not, I'm just there for 10 minutes. His nurse or therapist can sit with him in the garden for 1 hour, just enjoying nature. And that's just chilling out, you know. And I mean, it takes a lot of patience to do this lah, because on one hand, he is being worked up and you're there trying to, being present is important. And it was important because when my grandfather had those moments where he could talk a bit, you know, sometimes they conk off. I mean, sometimes they're a bit blur, sometimes they can relate quite clearly. He would tell me that, oh, actually I know this so and so is a good person because he just spent time with me there in the garden and can take my nonsense. It means he's actually a good person lah, but I mean, that's how he actually relates to the person. But it's quite true because, you know, towards the end stage of dementia, they are quite simple and they generally just want to know whether you're a friend or an enemy. It's very important because if it's a friend, they give their whole trust, and if you're someone they cannot trust, they will just veer away from you. It takes time, it takes patience, and really a lot of experience from the Comcast professionals. Another thing which I learned, in fact, last year during a similar edition of the fair, right, was that the therapists will actually do something called a touch therapy. So I wasn't very sure what was this last time, to be honest, but then I noticed that they would touch his hand, put their arms over his shoulder, simple sort of actions to relay to them. Because we also have questions on language barrier in the session, right? I can tell you that language barrier, if you have dementia, is, I mean, no matter what language you speak, right, you also can't get through. But then the touch therapy is quite important because touch is something very sacred. I don't know whether it's an Asian thing, probably because Asians, we tend to be more conservative. But when Asians do touch, right, you shake each other's hands, you hug each other, you just simply put their hands on their own, right? They feel it. So my grandfather also tell me he feels it because he, during those moments where he can, right, he tells me all these sort of things. Although it's quite hard to grasp, but these are the sort of things that actually work. Of course, it varies from person to person. So it's the job of the Comcare professional to find out and to apply. And I guess when you find success, right, you are very, very happy, probably very happy as a Comcare professional. And I think this is really what the whole thing, I mean, this is really what Comcare is about as a professional. Yeah. So yeah, dementia is my favorite question. And the nurse that I spoke to last year, she's actually taking her master's in dementia. So that also to address the career opportunities and the training in Comcare, I think it's something that is growing at a very fast pace and something that you really need a lot of relevant skills in. Okay, we shall take one last question from the audience. The question is language barrier. So do you study the various local languages before work or on the job?
I don't. So I maybe work on the ground. So I mean, being a Chinese, I only know English and Mandarin. So I think the beauty about working in Comcare is our patient becomes our teacher. They will teach us Hokkien, Teochew, Hainanese. That was the last thing that I had some challenges with. But at the end of the day, it's not about being able to communicate through verbal. Sometimes bring a smile, break the ice. Sometimes touch, like Nigel has mentioned, break the ice. And that's where it makes, from a rehab perspective, it makes rehab sessions much more pleasant and palatable. I had a lot of clients with different background that don't speak Mandarin or English. They speak like Malay. And I have some foreigners that probably speak Thai. I can't communicate with them a lot, and end up we use Google Translate, for example. But nonetheless, that does not create any barrier for them to achieve their rehab potential. In fact, I think that becomes a learning curve for myself and them. So that's where I think having different language does not sort of create barrier, but rather a learning journey for both the patient and myself.
For me, I can speak a couple of dialects and Chinese and English. I would like to think that the last 13 years, I learned a little bit of Malay as well. But on behalf of my foreign nursing aides and other nurses, I do see that they learn a lot of basic dialects, Chinese, and they can do it very, very well. Also, our nursing home itself, they do like classes for them for Chinese or basic Chinese, basic dialect speaking. So it's very good that they can learn as well. But on the job, they learn even faster. So yeah.
I think same for me. I pick up my Hokkien. I still cannot differentiate Hokkien and Teochew. So I always mix. Then I tell my client, Rojak is a Rojak language. But most important, they understand our instruction. And then we have the bonding. Yeah, that's the most important thing.
Thank you, speakers. If I could summarize, right, the most important thing is your message gets across, no matter the language or the dialect. Okay, it's 5:05 p.m., right? And we have come to the end of this Q&A session. Once again, we would like to thank the speakers for their time. Thank you so much for giving us this time amidst the busy schedule now, especially since the pandemic is raging on. Yep. So speakers, you may take your leave now. Thank you.
Thank you.
Thank you, everyone.
Thanks, everyone. Bye.
We have all participants for being so engaging and active throughout the 2 days. Don't forget that all sessions will be available for replay until 31st March. So do go ahead and view them on demand if you have missed any of them. We have an upcoming separate session on 5th of March titled Your Healthcare Scholarship Journey. This session will be interesting as you will be able to hear from our senior scholar share about his scholarship journey and his experiences with stretch projects, rotational opportunities, and leading a team. You also get to learn about the benefits of the scholar development framework from our MOHH Healthcare Scholarships team. So do tune in next week, next Saturday on 5th of March, and have a good Sunday evening and a good start to the day tomorrow. Thank you and goodbye.